I'm pretty sure you've seen her before on that ball. Right?
Is that the same girl?
That's the same girl that was doing the lunges, the jumps. And this is her trying to do core activation exercises. And she doesn't quite succeed.
What is she trying to do?
The whole point of this is just to get a 4-point stance, 2 knees, 2 hands, and stay on top of the ball. And it doesn't happen. Because the problem is people see it as going pretty easy. And if people don't use their inner core muscles, their inner abdominal muscles, then this becomes a whole lot harder just because the instability of the ball makes them roll, they overcorrect, they fall off the other way quickly. But you teach her a little bit of core activation. And this is a month later, 3 times a week for just a few seconds, and she can do now 2-point stance, which is pretty impressive. So it's not saying with core, it's typically not that the strength isn't there. Again, she's a ballerina, she plays that in volleyball, but so she's an athlete, so the musculature is there, it's just not used, it's not activated. She's never been taught how to use that properly. It's technique. Typically, I will see soccer players and track runners pull hip flexors because their core is not firing. Because it's changing that base of support for the rectus femoris to come off, so they're going to pull their hip flexor. So if you teach core activation, it stabilizes that base, the muscle can fire over the right length, it goes away. Patellofemoral problems, her pain goes down significantly. Her complaints about a day-to-day problem within 1 month, just by getting core activation going, and she's got a lot fewer complaints. Because you can imagine with her doing lunges where her shoulders are dropping all over the place and her arms are flailing to keep balance. If you stabilize that core, it takes away so much of that accessory motion, and now she's got a much better chance of having that patella track the right way. Make sense? So these 3 tests can be done pretty easily. To where I can take a whole team with just one person after another, set up one camera, run my entire team through, and I can get a pretty quick screen that identifies functional weakness at the hip, functional core problems, and I can either address the coach by saying we need to address these things in your strength and conditioning, or I can pull certain individuals out to then fix them separately. And it's a pretty quick and easy screen to be able to do. And if you do that, then the likelihood you're going to have a whole bunch of people coming in with patellofemoral problems is going to be drastically reduced. At the same time, it's the same basic screening that I would use to do ACL prevention. So all of these that have, I mean, when you cringe because you see, oh my God, how are you doing that? It hurts me to watch. Those are the same kids I'm worried about tearing an ACL. So again, if I can pre-screen this, it's hitting any patellofemoral problems and certainly ACL risk of injury. Because what's the number one way to tear an ACL?
Deceleration.
Deceleration and plant internally rotate. Right? What's the number 2 way to tear an ACL?
Trauma.
Hyperextension. Stiff leg the ground, then knee goes backwards.
Oh, that's what happened to me.
Is that an ACL?
So,
Makes my foot feel.
Oh, okay.
lunges, jump.
That's what happened to me.
Really?
Yeah, when I was dribbling the ball. There was a pop when I stepped in my whole weight.
You popped them?
So yeah, you can. I mean, this one on the left. I mean, you can just by the shake and the reverberation of her body when she landed, you could feel the impact was heavy. So jump training with her would be phenomenal.
You can just see how hard your legs
And again, you see their knees knocking together almost every jump. So there's significant strength issues in this team.
This is all middle school.
What's that?
This is all middle school.
This is a high school team.
Must be fresh.
Must be fresh.
Very small.
out completely.
Like, the knees are clamping together.
She's barely getting
Yeah,
out.
this one here, you can see the vibration and just the shock of the spine to the ponytail when she lands. And it doesn't have to be that way. You can easily do jump training, and within a couple days, within a couple prompts, you can get somebody to land softer. Yep.
Do athletes in certain sports do these exercises better compared to other athletes?
I think they have to, yes. I mean, if I go and take a swimmer and put them and do jump training, well, I always got to pick on swimmers. Then there's just going to be a difference. Now, and if I take levels, if I go and take a D1 college versus any of my middle schoolers, you're going to have significant differences because, again, they self-select. But then the question becomes, if you're in that setting, if you're involved with school programs, athletic programs, if you build in these kinds of preventative things, if you build in things that help strengthen and decrease these impacts, how many more would stay in the sport because they never have those injuries and those pains? How much better could they get if we increase their vertical, I mean, because in the process of fixing their jump training, their jump landing, I could probably end up giving them a 3-inch increase on their vertical jump, just because we're getting the mechanics right, and that's going to make the muscles fire better. A little bit more, I can give them upwards of 5 and 6 inches increase. So if they're that much more powerful and more stable, they're going to get hurt less, they're going to be stronger on the field. It's going to change everything about them in terms of how well they do. So certain sports, sure. I mean, I think there's soccer and basketball compared to synchronized swimming, there's going to be a difference. And the reason for that is because the demands of the sport are different. I would never pit my soccer players against anybody in a pool if they did synchro, because my soccer players would drown. Doggy paddle. So,
Good, I'll get that.
Please use my legs.
so some things we can't fix. I can't really fix those static components, but those dynamic components for both ACL prevention and patellofemoral prevention, we can easily identify where some of those dynamic functional issues exist and be able to address those. Pretty significant. Patellar subluxation and dislocation.
I had
Far more common in females than males. And part of that is going to come down to that whole vastus lateralis versus vastus medialis. If I have a lot stronger pull from one side than the other, then it's going to be pulling it and torquing it to the lateral aspect. So a lot of the same reasons that I start seeing patellofemoral tracking issues, I'm seeing dislocation issues. I had a friend who she would be sitting and watching a movie, and her kneecap would spontaneously just pop out of spine. And it hurt until it gets put back in place. And this is one of those times that I'm really not too hesitant to reduce one of these. Because all you have to do is just very, very gently let the knee straighten out, and it will almost always just slide right back into place. So you're putting slack on the tendon, slack in the muscle, and it will just reduce itself, slide back into place.